I'm hopeful for the first time in 6 months that we may be in a position of bipartisan support of actually looking at the Affordable Care Act and actually fixing the parts that aren't working. My name is Tom Andrews. I'm the president of Mercy Care Services here in Atlanta, Georgia.
My name is Kelly McCutcheon. I'm president of the Georgia Public Policy Foundation. We can do this much more efficiently. We're already spending the money. It's just very inefficiently spent. We can take care of these individuals and relieve the burden on a lot of other people and get to a system that works a lot better.
I do think that our Medicaid program can be strengthened in some ways and innovation should be encouraged, but we shouldn't give up the safeguards and the funding that we have in order to get to that innovation. It's really hard to be creative and innovative if you don't have the dollars to do it. My name is Laura Colbert. I'm the Executive Director of Georgians for a Healthy Future.
My name is Steve Walsh. I'm an anesthesiologist in Roswell and the current president of the Medical Association of Georgia. You've heard the numbers, where healthcare is approaching 20% of GDP. Companies can't afford it. Families can't afford it. We have to do something. We have to do something to make it more affordable.
A big part of health is access to care. So we want to be a state that attracts the most physicians, nurses, nurse practitioners, physician assistants, pharmacists, behavioral health professionals. The more we can attract and retain healthcare professionals, the more we can enhance access for our citizens. And that's an important element of this puzzle that we have. My name is Chris Kane. I'm a principal with the company of Progressive Healthcare, Inc. that does advisory services in the healthcare industry.
So Congress is coming back into session after Labor Day weekend. It has tried and failed to repeal and replace Obamacare. Now, starting this week, September 5th, some senators hope to work on fixes to the federal healthcare law. On that subject, we have these questions. First one is, what is the most important thing that Congress can do to help Georgians?
The first thing that Congress should do when they get back in September is to guarantee that cost-sharing reduction payments will be made to insurers and to appropriate those funds through at least 2020. If without those payments, insurers are going to have to raise premiums to make up for losses. The Congressional Budget Office thinks that will require about a 20% increase in healthcare premiums for consumers. And so having those funds appropriated and the certainty that insurers will receive them will go a long way to making sure that prices stay flat or there's less risk of high increases for people in Georgia in particular.
There are thousands of people in Georgia that have seen their premiums double. And they've been told that their premium is going to go up another 40 to 60% next year. I mean, if you're a family, that's scary. I mean, I don't know how people are going to afford that in the first place. And second, most of Georgia has a situation where there were one press conference from an insurance company away from not having anyone in the exchanges to buy insurance from. So there are fundamental changes that need to be made. Congress has got to step up and do their job. There may be compromises that need to be made, but that's what we put them there for. And whether it's working with Democrats or getting the Republican caucus together, they need to come up with a plan, work it out with the House and the White House, and get something passed to give the states some relief and give individuals an ability to buy health care at affordable prices.
I think Congress can help with that anxiety by, number one, working to stabilize the insurance market. A lot of people are wondering whether they'll even have an option to buy insurance. Secondly, there are a lot of good key provisions in the ACA law that we need to maintain. Those provisions are things like a pre-existing disease, the medical loss ratio, and being sure that there's no lifetime limit placed on insurance benefits.
With the uncertainty in Washington, what is the most important thing the state of Georgia can do to position itself?
Well, the great news about the lack of action in Washington is we didn't really have to have them pass anything for Georgia to move ahead with a waiver. In the Affordable Care Act is a provision called the State Innovation Waiver Program, and it was only activated this year. 2017 was the first year states could apply for a waiver, and it's probably one of the most broadest waivers we've ever had at the state level. And with Tom Price at Health and Human Services, who has begging states to send him innovative ideas. This is a golden opportunity for Georgia to take control of health care, address our problems in our unique way, and I think make some outstanding progress in health care, lead other states behind us just like we have in criminal justice reform, and the states then will have an impact on what the federal government does.
I think we need to get away from the whole focus around we're not going to expand Medicaid. That's what it's been for the past 5 years. No, we're not going to expand Medicaid. But we can talk about some transformational ways that we can bring some of the federal dollars down through things like 1115 waivers and other special grant opportunities that would allow us to expand access to people that are poor and underserved and do not currently qualify for Medicaid, but don't put them in the Medicaid system. Put them in a different delivery system similar to the one that Grady and Mercy Care and other community health centers put together as a proposal to the governor about 3 years ago. It's very unique, it's very different, it's not the same old, it really is looking at how to be more efficient with delivering care and how to make sure that you're delivering good outcomes.
Georgia should look at where can we have pilot programs that enable us to be innovative, and that might encompass how we fund and operate Medicaid. Perhaps we ought to consider asking the federal government for a waiver if we can find a compelling approach to Medicaid that fosters access but also maintains quality. So for Georgia, we need to consider what are the unique circumstances of our state. And another consideration is we need to advocate for rural health care. Many times those in Washington, and even in our state as a whole, overlook the importance of rural health care in maintaining community pride, driving employment, and truly being a foundation for the overall local economy in our smaller communities. And we need to look at the financial health and viability of our hospitals in our rural communities.
What is the most important thing that consumers can do to protect themselves and their families?
So everyone in Georgia benefits in some way from either the Affordable Care Act or Medicaid. And I think understanding the benefits that everyone in Georgia gets from those programs is important, but going beyond that and having consumers talk to their elected officials, both at the state level and at the federal level, is important. Our elected officials can't address issues and real issues that people are experiencing in the healthcare system unless they're hearing from their constituents. And so people should take the time, write their elected officials an email, what's working in their health for their healthcare, what's not working, and then that provides elected officials with some feedback and some real data to move forward and provide solutions for people.
I think consumers are scared right now because I think those that have benefited from the marketplace are unsure whether or not they're going to be able to continue to benefit from insurance through that mechanism. So I think they need to really advocate on behalf of themselves and talk to their legislative folks to make sure they're clear about the benefits that they've received. But on the same side, or on the other side of that, they've got to make sure that those insurance policies are affordable. So I think they need to also emphasize with the legislature that they need to find a way to help the insurers make it more affordable in the state.
Fundamentally, consumers need to have some type of coverage. So even if it's catastrophic care with a high deductible, it is important to have some type of coverage for your family. And the other is to embrace primary care. Each family ought to access primary care where they can at a reasonable cost that they can afford to maintain some level of health.